Mr Speaker, amidst our cost of living crisis created by Labor, people's health and wellbeing are suffering. That's why we committed to restoring the number of Medicare subsidised psychological sessions from 10 to 20 and on a permanent basis. As Health Minister, I increased hospital funding year on year. I also established the $20 billion Medical Research Future Fund, which to this day provides billions of dollars to medical research projects. Indeed, when I became Health Minister in 2013, we inherited a bulk billing rate from Labor of 73% and increased it to 84%. When we left government, bulk billing was 88.5%. What Labor tried to hide in its budget, and a figure that wasn't mentioned by the Treasurer, is that bulk billing has decreased under Labor to 77%, an 11% drop. Always look at what Labor does, not what they say they will do. Mr Speaker, the health of all Australians, particularly given our ageing society, is always a priority for the Coalition. Last year, I committed to an investment in best practice for women's health issues, including endometriosis. Tonight, I welcome the government's commitment of $50 million in this budget for longer consultations for endometriosis and pelvic pain. The Coalition will continue to support measures for women's health, particularly in primary care settings. More needs to be done to support women's health, including for menopause and perimenopause. We will continue to develop and support good policy to this end. We'll work with the RACGP, AMA and other stakeholders who want to see more support for women in our community. Concerningly, Australia is facing a looming shortage of GPs, some 11,000 by 2031. We need more GPs, especially in our suburbs and in our regional areas. Junior doctors who enter general practice earn about 3/4 of the salary of their counterparts in hospitals. Working with the Royal Australian College of General Practitioners and the Australian Medical Association, the Coalition Government will invest $400 million to provide junior doctors who train in general practice with incentive payments, assistance with leave entitlements and support for pre-vocational training. We'll also make sure that we support better outcomes for Indigenous Australians through the health system. Led by Senators Little and Amber-Jimper-Price, we will provide practical solutions to improve education, health and safety outcomes for Indigenous women and children, especially in our most disadvantaged remote communities.